State Senator, Mr. Runestad, who is part of the governor's problem this week. You've not exactly been very kind to her. In fact, you want to block her appointment to replace Mr. Gordon. Let me ask you this question. Are you willing to let that appointment of Ms. Hertel go through without a vote in the Senate, and you can get your pound of flesh but still give her the job? Are you willing to do that, sir?
It would be my preference that we do take up a vote on her confirmation. I'm not sure at this point if that's going to happen or not, but definitely I would like to have a vote. There's been some interesting things that she has said in the advising consent that has caused a number of Republicans to have concerns. And so I would like to be an up or down vote and see where the caucus is at.
But if there is no vote, you're not going to go bonkers and let it go through, right?
Well, it's going to probably be a decision of the caucus. If the majority support her, then that's going to be the way it's going to be. If the majority are against, then I think we're going to have an up and down vote, and that's going to be a big discussion this week for sure.
Dave, jump in.
Hi, yeah, thanks. I appreciate it. Senator, can you point to the one issue that you think that Acting Director Hertel was the biggest red flag for you? Again, we've heard from other lawmakers that she is a better communicator than Robert Gordon, that she's had a better history of working with Republicans and Democrats than Robert Gordon. What was the big red flag for you?
Well, there was two. One, that she was asked how long would she retain these emergency powers, and her answer was, in essence, indefinitely, is the possible answer to that. And secondly, what did the department do wrong? And she couldn't come up with an answer. You look at the contact tracing, what a disaster that of the thousands of companies that could do contact tracing, the department looked thoroughly through them all. And lo and behold, the only one that they could use, the one that has to run around all the regular rules in order to get this special contract, was the data contact tracing, the data company for her campaign, who runs liberal national campaigns across the country. What a canard. So I asked for an investigation of that of the Attorney General. By all accounts, it seemed the investigation was pretty thoroughly done until she ran into a stone wall from two key people in the administration who refused to testify. So that right there is not building transparency into the equation as the governor said she was going to operate, nor in Hertel, Director Hertel, who couldn't think of one thing that went wrong. Now we're looking at all these nursing home issues, and there's nothing that she would have done differently in terms of all of this nursing home disaster that we have been finding out week after week unrolling.
Zoe.
Sure. So we're now, I think, at what is the number, Senator, 18 appointments that the Republican-led Senate has not approved under this governor. And basically, folks are saying it's purely political, right? These are positions and jobs that really have nothing to do with the pandemic or the coronavirus. Now that we are at a position that really is so intertwined with COVID-19 and that oversight, how can folks really trust that this does have to do with Elizabeth Hertel's possible management versus, what these past 18 non-approvals have meant, and that is that it's just politics?
Well, the 18 individuals prior to that, it was a decision made by the chair who had reviewed their applications and had some concerns with it. I'm not on advice and consent, so I can't elaborate on what the issues that the chair found with these individuals. But like I just said, the Department of Health and Human Services is the largest department, the largest budget with this COVID, the most important department in the state of Michigan by far. So this is not an inconsequential appointment. This is extremely important to get this right. And like I said, the fact that she thinks that, she can retain these powers, the entire time that the governor's in office with no data, no matrix as to why this has occurred, that everything that the department has done, she couldn't find one thing to improve. Those are major, major considerations. I think for the public, as it unwinds, the public's going to have more questions, not less.
Zach.
Senator, I mean, isn't the advice and consent process designed to prevent someone who's wholly unqualified from being appointed? I mean, the governor, would you agree? I guess I have a multi-part question. One, does the governor have the right to appoint people to run her cabinet as opposed to the Senate? And two, isn't Elizabeth Hertel, having worked in a multitude of positions in what was formerly the Department of Community Health, is now the Department of Health and Human Services, and as a former legislative Republican staffer on health policy, isn't she qualified? And don't you have to fight out the policy differences differently as opposed to through the advice and consent process?
Well, again, this department has been responsible for most of the major decisions that is basically propping up the decisions by the governor. So were these the proper decisions? We're hearing things all over the map. We were told that until the end of February that schools couldn't have the athletics. And then all of a sudden, lo and behold, when there's a rally in the steps of the Capitol by over 2,000 parents, teachers, coaches, the science changed. And 2 days after that, and they lifted the ban on winter sports. I don't think that the science changed. I think that it was the people who said, we have had enough. There's so many decisions that have been made by the department that made no sense early on when they said that you could have you could not have one guy go fill up his gas tank and mow 10 lawns, but you have 10 people go mow their own lawn and filling up their gas tanks and spreading the disease. That makes sense. That you could go buy lottery tickets, marijuana, booze, but you couldn't in the summer buy things for your home, wood chips, paint. There's been so many decisions that didn't make sense, but there's not one single altering decision that Elizabeth Hertel came up with that she would change. And I mean, we know a lot now. I would assume that there's some things she could say that these didn't make sense. Maybe we didn't know enough. But no, there's nothing that she would change up to this point. This is the most important appointment that we are going to approve or disapprove during her entire administration.
Senator, you've been critical of the governor's handling early on in the pandemic vis-a-vis the nursing homes. You are not accusing her of covering up the deaths in nursing homes, are you, or are you not?
We have been asking for the data. What we found out just yesterday is that Governor Cuomo in New York had the staff cook the books and were hiding the numbers. What they were doing is a person would die in a would get infected in a nursing home, and they would send them to the hospital, and they would die in the hospital. They said, oh, but that was at the hospital. That wasn't anything to do with the nursing home, when in fact, it was in all likelihood the policy of the governor that required the nursing homes to take COVID-infected patients into the nursing homes, and thus were infecting the non-infected patients. 5 states did that. Michigan's one of them. The governor said that this is a policy that she's going to stand behind. And how much spreading did that do? I've talked to a number of people who worked in these. They said that there was not proper procedures that were done in the process, and that sometimes it was just a plastic curtain that separated these, and they had cross-contamination of employees going back and forth. So there's major questions, major statistics that we need to get to the bottom of. We're not just going to accept that the governor says everything is great. We have great statistics. We have great data. Steve Johnson has asked her department head, Hertel, for this information. She refuses to come in and testify before the Oversight Committee in the House.
So, Senator, are you accusing the governor of trying to hide some of the deaths in the nursing homes?
I am accusing her of lack of transparency. What we found out with Director Gordon is that the governor said, we're going to make sure you can't talk. We're going to give you all this money provided you don't talk. And she attacked the Snyder administration for, I think it was 2 months that her Treasury director collected money. This guy's going to collect 9 months and can't say a word. I think that what was going on is there was a whole lot of disastrous decisions, crash and burn decisions in DHHS. And Gordon knew about them, and that she wants him to stay silent, not say anything. That is what I think happened. So we're not getting answers on any of these things. So we're not going to make accusations till we know what the facts are, but so far we're not getting any facts.
Are you going to subpoena him to come in, Mr. Gordon?
My understanding is that that was talked about this week, and it's going to be discussed even further next week.
And would you vote to do that, sir?
Yes, I would.
All right. We're going to take a pause here for some closed credits. You've agreed to stick around for some more questions. We've only sort of just touched the surface here. You willing to do that, sir?
Yes.
Great, great. Let's take a panelist. Hang on just a second. We'll do some closed credits, and we'll be back with Overtime with the Senator. If you'll go to WKAR.org, see you then.